Okay, so in section 6, we are going to drill down a bit further into improving psychotropic adherence, targeting reasons for non-adherence, and a 3-tiered approach to enhancing medication adherence. So as we've touched on already, it is important for clinicians to try to target the reasons for poor adherence, assessing why a person is poorly adherent, so the intentional versus the unintentional, can'ts versus won't. Underuse tends to be the most common, and reasons can include forgetting, negative attitudes toward treatment or medication, side effects or fear of side effects. Overuse is less common, but definitely can occur. Increased dose in the mistaken belief that if I take more, my recovery will be faster. Or forgetting, if a person took a morning dose of medication, for example, and just forgot that they took it, they could potentially take it again. This slide here, based on a patient questionnaire, looked at reasons for not taking medications, and you can see that forgetfulness was the biggest reason. And so knowing that, you can think about ways to prompt remembering. And then there are a variety of other reasons that include lack of information, other priorities, and emotional factors. The next slide shows us top reasons for poor antipsychotic adherence. And the top reason was poor insight, substance use, attitude toward a medication, all being the top 3. Medication side effects were a 4th reason here. Often clinicians think that side effects are the top driver. Our data didn't suggest that that was the case, although it was still an important reason. And as we've discussed earlier, side effects should definitely be part of the discussion with patients. In some qualitative research that we've done in people with bipolar disorder, where we wanted to focus on the positive aspects, we asked patients with bipolar disorder, what do you think medications are doing for you? The most common positive response was balancing or stabilizing my mood, then decreasing my anxiety or depression, and improving sleep, and mainly focusing on the depressive aspect. So in order to partner with patients, not only is a good idea to find out what their barriers are, so why are they not adherent, but also what do they believe the medications do for them? So both the positive and the negative, both of those should be in part of the discussion. The 3-tiered approach to enhancing psychotropic medication, this is adapted from an Institute of Medicine recommendation. So we can think about adherence enhancement approaches or adherence enhancement interventions. We can think about them as universal, selected, and indicated. So universal are things that are easy. They're administered to all patients. This tends to be low burden. That include refill appointment, reminders, customized dose schedules. Selected AEs are a little bit higher burden. They're administered to people at risk for non-adherence. That might include things like motivational interviewing or environmental support, adherence monitoring. And then indicated AEIs are of the highest burden. These are highly customized interventions administered to patients with a record of poor adherence in the past. It could include home visits, directly observed therapy where you watch people take medications. Other things that we can do are to simplify the dosing regimen. So this is an oldie but goodie slide that shows that percent adherence is higher with once daily or Q-day dosing and goes down the more times a day a person has to remember to take the medication. One way to think about it is every time a person is supposed to take a medication, that's a decision point. Take it or not take it, forget it or not forget it. And you want to minimize those opportunities. Other things we can think about is different formulations. So there are some long-acting injectable formulations available for antipsychotic drugs, and that is a possibility for people that are poorly adherent, and that will take that QD dosing directly out of the mix, where maybe it could be administered monthly or even less frequently with some of the compounds that are available. Key points in this section is that understanding why individuals are suboptimally adherent can help guide effective strategies to promote adherence. Just as there is no one-size-fits-all reason for poor adherence, there is no one-size-fits-all way to improve adherence. Using multiple drug approaches, such as providing drug formulations that minimize having to remember to take medications and building in reminders or cues to tie medication taking into daily routines, can all enhance adherence. And patients may need approaches that are more or less intensive based on their personal circumstances, attitudes toward both medications and treatment, and their engagement in care.